Hello everyone, welcome to Jessie's MedBio. In today's section, we are going to discuss about next two topics from the first chapter. So, the topics are the first one is national policy and legislations in relation to child health welfare, and the second one is national programs related to welfare services to the children. So, first I am going to explain about the national policy. The National Policy for Children is a policy of the Government of India to ensure that every child receives proper care, protection, education, nutrition, and opportunities for development. National policy is a type of policy which was established or which was implemented by the Government of India. Under this policy, they are ensuring that each child should get proper care, protection, education, nutrition, and also the opportunities, good opportunities for their development. And under this policy, they are saying that India has the largest child population in the world, and also the constitution guarantees children's fundamental rights. National Policy for Children was the India's first policy which was developed for the welfare of children. And here the National Policy for Children was implemented on 1974. Under this policy, they are saying that children are the nation's most important asset, and also the government has the responsibility to protect and develop every child. Under the National Policy for Children in 1974, they are saying that children are the nation's most valuable asset. The asset means valuable resources, which means children are considered as the future citizens of our country. So their growth, their development, their educational level will determine our country's development in the future. Then each child should get proper nutrition and proper health care, and also free and compulsory education should be provided. And each child should be protected from any type of negligence, abuses, exploitation, and child labor. And also equal opportunity should be given to all the children for their physical, mental, emotional, and social development. These are the things they are mentioning under the National Policy for Children in 1974. Then the National Policy for Children in 1974 was replaced by National Policy for Children in 2013. It was get updated. Under this, they are saying that it is based on a child rights approach and follows the principles of the UN Convention on the Rights of Child. The National Policy for Children in 2013 mainly focusing on the children's right. Here they are saying that defines a child as any person below 18 years of age. Here they are considering the person who is below 18 years of age, and they are providing all the care, all the holistic care to the children below 18 years of age. And here they are saying that each child has the right to survival, health, nutrition, education, protection, and participation. Then every child should grow up in a safe, loving, and family environment. And also here they are providing special care to the vulnerable children. Those are orphans or the children with any disabilities or children affected by poverty or abuse. To that kind of children, they are providing special care and attention. And the government is responsible for ensuring the overall development and protection of every child. Next, I am going to explain about the preamble which is coming under the National Policy for Children in 2013. Preamble explains the basic principles of the National Policy for Children. Preamble means it mainly focusing on the basic principles. So recognizing that a child is any person below 18 years of age, which means anyone is younger than 18 years is legally considered as a child. Then childhood is an important stage of life. In one person's life, the childhood is an important stage because the childhood will act as a foundation for an healthy physical, mental, emotional, and our social development. Then every child is different, and each child will have different needs according to their age, health, family and their living environment. Then holistic approach is needed. A child should get holistic level of care in all the areas like health care, nutrition, education, then protection or love. In all these areas, the child should get proper care. That is about the some principles. Then reaffirming that means the confirmation. That I already explained that every child is a national asset. Then special protection should be given to vulnerable children, which means those are orphan or physically not disabled or poor children. To those kinds of children, they are providing special care and attention. Then every child has the right to grow in a loving family and environment. Then families should be supported. The government should help the families in providing proper care and protection to their children. Then the government is responsible for the child care, which means the government should protect, support, and empower every child so they can grow into a healthy, educated, and a responsible citizen. These are about the preamble. Then next one is the guiding principles. Under the guiding principles, they are saying that every child has equal human rights, all children's rights are equally important, every child has the right to life and development. Development is not only physical, which means development should be present in all other areas like emotional, health, mental, and social. Then no discrimination. Then best interest of the child, which means according to the child's interest or according to the child's needs, we have to act. Then family is the best place for a child. Protection from abuse. Children should be heard, which means children have the right to be express their own opinions and the adult should listen and act accordingly. These are the major guiding principles which is coming under the National Policy for Children. Next one is the key priorities. Under the key priorities, 4 things are there: survival, health, nutrition, education and development, protection, and participation. Survival means what? Every child has the right to live. Health means each child should get proper health care, then vaccination or nutrition. And also under the nutrition, which means each child should get proper nutrition and we have to prevent the malnutrition and all. Then education and development means each child has the right to get free and quality education. Then protection means the child should be protected from any type of negligence, abuses and child labor and all. Then participation means we have to encourage the children to express their own views and opinions. These are the major key priorities which is coming under the National Policy for Children. That is all about the national policies. Then I am going to explain about the legislations. Here mainly I am explaining 6 Act. So the first one is Children's Act in 1960. Here they are mainly focusing on the neglected and delinquent children. Delinquent means the children who are engaged in an violent behavior or who are breaking the social rules. They are providing care, protection, education and rehabilitation for those kind of children. The major points, important points are they are protecting neglected and abandoned children, then establishing children's homes, then providing education, treatment and rehabilitation, and ensuring child welfare and proper care. This is coming under the Children's Act. So, second one is Juvenile Justice Act in 1986. Here they are mainly focusing on the juveniles. Juveniles means the child who is not reached at the age of an adult. Here they are providing care, protection and treatment to the juveniles. Then the important points were separate justice system was there. Then they are reducing the police contact. Then observation home and special homes were there for them. Then here they are focusing mainly on the rehabilitation rather than the punishment. And also they are encouraging the adoption and child protection. Then third one is Child Labor Prohibition and Regulation Act in 1986. Here they are prohibiting or preventing the child labor in hazardous occupations and also regulating the working conditions in other jobs. They are prohibiting employment in hazardous work and limiting the working hours, and they are prohibited the night work, especially from 7 p.m. to 8 a.m. Then weekly holiday they are providing. Then punishment for employees violating the act, and those who are violating this act, the government should punish them. Then fourth one is Child Marriage Restraint Act in 1929. The main purpose is to prevent the child marriage. We all know about the minimum marriage age. For male, it should be 21 years, and for the female, it should be 18 years. And those who are conducting or those who are promoting or those who are violating this act will be get punishment. Then here they are protecting the children's health and rights. Then fifth one is Education for All Handicapped Children Act in 1975, which means here they are providing free and appropriate education or free care to the children with any type of disabilities. They are providing inclusive education, then equal educational opportunities, special education services, and promoting maximum development of the children. Then last one is Child Abuse Prevention and Treatment Act in 1974. Here they are preventing the child abuse and the negligence, and also providing proper treatment and rehabilitation to the children those who are abused by others. Here they are defining the child abuse and neglect and reporting and investigating the abuse and protecting and rehabilitating the victim, and also training and awareness programs for prevention. These are the major legislations. So next I am going to explain about the national programs. Here around 60 national programs are coming, so I am just giving a summarization of all the programs. If you want the detailed notes, let me know. So the first one is Universal Immunization Program. It was established on 1985. Here they are protecting all the children and pregnant women from the vaccine preventable diseases. The major services are preventing the infectious diseases and reducing the infant and child death, and also achieving the full immunization coverage. Next one is Pulse Polio Immunization Program. It was established on 1995. The major aim is to eliminate the polio by giving the polio vaccination to all the children who is below 5 years. Here they are preventing the transmission of polio virus and eradicating or eliminating the polio, then maintaining the India as a polio-free status. Then third one is National Health Mission, established on 2013. It was established to improve the healthcare services, and here they are merging National Rural Health Mission and National Urban Health Mission. Here the major activities are reducing the maternal and infant mortality rate. Mortality means the death rate. Then improving the maternal and child health. Then providing affordable and quality health care. Then strengthening the public health services. Then fourth one is Reproductive and Child Health Program. It was established on 1997. Here they are mainly focusing to improve the health status of women, newborn and the children. They are promoting safe motherhood, improving the child survival, then providing family planning services and preventing and treating the reproductive tract infection or sexually transmitted infections. Then fifth one is Janani Suraksha Yojana. It was established on 2005. Here they are mainly focusing, or here they are encouraging the pregnant woman to deliver in hospital. So they are increasing the institutional deliveries, reducing the maternal and newborn mortality, and also providing financial assistance, which means the economical support to the pregnant woman. Then sixth one is Janani Shiksha Suraksha Karyakram. It was established on 2011. Here they are providing free healthcare services to the pregnant woman and the sick newborns. The services are they are providing free delivery, free medicines, free diagnostics, then free blood, free diet and free transport. Then seventh one is integrated management of neonatal and childhood illness. It was established on 2005. This is strategy which is mainly focusing to prevent and manage the common illnesses in newborns and children, which means the diarrhea, fever, such kind of common illnesses. Then here the major services are they are reducing the child death, then improving the early diagnosis and treatment, and promoting the nutrition, breastfeeding and immunization. Then eighth one is facility based newborn care. It was established on 2006. Here they are providing specialized care for sick and low birth weight newborns in health facilities like newborn care corner, then newborn stabilization unit, then special newborn care unit. Under all these kind of units, they are providing specialized care to the sick children and those who are having low birth weight. Then ninth one is home-based newborn care. It was conducted or the home visit was conducted by the ASHA workers. They are visiting the home and they are providing the care for the newborns after the mother is getting discharged from the hospital. Here they are providing the services like promoting breastfeeding, then identifying the danger signs, then ensuring the immunization and also reducing the neonatal death. Then 10th one is Navajat Shikshu Suraksha Karyakram. It was established on 2009. It was a training program provided to the healthcare workers on the newborn care. About the newborn resuscitation and how to prevent hypothermia and how to promote early breastfeeding and how to reduce the birth asphyxia. In all these kinds of things, the healthcare members are getting training. The 11th one is Rashtriya Bal Swasthi Karyakram. It was established on 2013. It is a child health screening and early intervention program. Here they are focusing on the children from the birth to 18 years. Here they are detecting the 4 Ds, which means defects, deficiencies, diseases and developmental delays. They are detecting these 4 Ds early and providing the care according to that, providing early treatment and the referral. Then 12th one is RMNCH plus A strategy, which means RMNCH plus A means reproductive, maternal, newborn, child and adolescent health. They are mainly focusing in providing reproductive, maternal, newborn, child and adolescent health. They are improving the health at every stage of life and reducing the maternal, neonatal, infant and child death rate and improving the adolescent health and ensuring the continuity of health care from the adolescence to motherhood and childhood, which means they are providing the proper health care and also they are reducing the maternal and childhood mortality and all the stages, which means in reproductive stage or the maternal time or for the newborn or for the child and also for the adolescent, they are providing proper care. The next one is special nutrition program. That is the 12th one. It was established on 1970. Here they are providing supplementary nutrition to children below 6 years and for pregnant women and for nursing mothers, which means for the lactating mothers. For children below 6 years, pregnant and nursing mothers, then supplementary food means 300 kilocalorie and 10 to 12 gram of protein per child per day and 500 kilocalorie and 25 gram protein per day for mother. Supplement provided for about 300 days in a year. In a year, they are providing these supplements for 300 days. The major aim is to improve the nutritional status of the target groups. Target groups are the mother, lactating mother, pregnant woman and the children below 6 years. Then 13th one is Balwadi Nutrition Program. It was established on 1970. It was started in 1970 to provide supplementary food and pre-primary education to children from the age of 3 to 6 years in rural areas through Balwadis. Through Balwadis or through Anganwadis, they are providing supplementary food along with the pre-primary education. The food supplement is from the 300 kilocalorie and 10 gram protein per child per day. Then 14th one is Integrated Child Development Service Scheme. It was established on 1975. These programs aim also to improve the nutritional and health status of children, adolescent, pregnant and lactating mothers through integrated services. Here also they are providing the supplementary nutrition and also the vitamin A prophylaxis, then IFA tablets to the preschool children, adolescent girls, pregnant women and for the lactating mother. Next is the last one, that is Midday Meal Program. It was established on 1961. The major aim is to attract more children to schools and to improve the literacy. For improving or for developing the educational level of the children, they are attracting the children to the school. Here they are helping in the retention of children and helps in the improvement of literacy. And this midday meal program is also known as school lunch program. Some guidelines are there for the midday meal preparation. That is, meal is a supplement and not a substitute. And also it should supply at least 1/3 of the total energy requirement and half of the protein needs per day. Then cost of the meal should be low. Then meal should be easy to prepare and locally available food should be used to reduce the cost of meal. And also the menu should be frequently changed. Per day for per child, 75 gram of cereals and millet should be given and also 25 gram of pulses should be given. These are about the national programs for the child care. These are the two topics we discussed today, that is national policy and legislation, and next one is the national programs.